what exactly a mommy makeover is a little bit more complicated than you think. What happens when you have children is that the milk ducts in the breast actually... All right, welcome back everyone. My name is Dr. Saadat. I'm a Beverly Hills plastic surgeon, and today I'm going to tell you what exactly a mommy makeover is and what it specifically entails. You've probably heard this term used on social media or on different plastic surgery websites, especially if you've had children, but a lot of times people don't actually understand what goes into a mommy makeover. And the answer is a little bit more complicated than you think, but ultimately I will say there are two procedures that are typically the gold standard for a standard mommy makeover, and that's going to be number one, a breast lift, because what happens when you have children is that the milk ducts in the breast actually engorge, enable you to breastfeed. As a result, that causes the skin to stretch out, and then once you're done with breastfeeding, those milk glands deflate, and all that extra skin and fatty tissue that's been deposited through the breastfeeding process causes the breast to almost get a pancake-like appearance where it drops and flattens out. So that's why a lot of women would like to have a breast lift after having children, because what I do is I remove some of that extra skin, I reposition the nipple, and sometimes women who want to be a little bit bigger because they've lost some volume from breastfeeding will oftentimes want either fat injection to the breast or even an implant placed underneath at the time of the lift, and it is possible to do those two together. Now, the other procedure that is often included in a mommy makeover is going to be a tummy tuck. The reason for that, as you can imagine, when you have children, obviously the abdominal muscles stretch out, the whole abdominal wall stretches out. It's very normal to have loose skin, especially in the lower part of the belly. And on top of the loose skin, people get something called a diastasis recti, which is where the six-pack muscles, the rectus abdominis muscles that create that six-pack effect, what they do is they actually separate during pregnancy because of the stretch, and then almost never do they go back to their original position because that separation is actually a tear in the connective tissue, and the only way to really fix it for the most part is going to be through surgery by stitching those muscles back together to give you that core function back. So not only is a tummy tuck in a mommy makeover aesthetic, but it is also functional, where it can help with things such as urinary incontinence and even lower back pain that may have occurred due to the loss of function of the core muscles. Now, there are a couple other procedures that I've noticed have been added on to mommy makeovers, and that is sometimes doing fat grafting to the hips or the buttocks, meaning I take some liposuction fat from the flanks and from the waistline and retransfer it back to the butt area just to give that more hourglass figure. Also, 360 liposuction is an option instead of a tummy tuck for some women who don't have a lot of extra skin, because again, with liposuction, obviously if you're removing volume and you don't remove skin and there is loose skin, that loose skin is just going to get worse because you're just taking out the volume that exists underneath that baseline level of skin. So there are some women who may be candidates for that. And the other thing I will say that a lot of women like to have done, especially as of late with this procedure getting more popular, is facial fat grafting. So I have done it where I'll do a breast lift and a tummy tuck, do a little bit of liposuction, because usually with the tummy tucks I do some liposuction just to bring in the waistline, but instead of throwing that fat away, what do? I inject it back into the face. Now, what's the timeline of having a mommy makeover? I know a lot of women who, right when they have a child, they look at their bodies, they're not happy with what they see, they feel like they've lost something, but it's not time right away to do a mommy makeover, unfortunately. What we need to do is let the body heal, get into a more normal, regulated state. So usually I say about 1 year after the last child was born, should you wait in order to have any kind of mommy makeover procedure. And then also ultimately, sure, you can have children after having a breast lift or a tummy tuck, but if you're planning on having multiple children, I typically recommend that you wait until the last child is born in order for you not to have to go through that procedure again, because obviously if I repair things after your second child, let's say, and you have a third child, you could return back to that separated muscle and breast drop after the third child. So it's just better to wait until you're done having children. So ultimately, if you're interested in a mommy makeover, go ahead and contact my office. Let's chat about it. You know, I think it's so important to take care of mothers and their bodies and allow women to feel comfortable with who they are given the difficulty of childbearing. So ultimately, If that's what you want, go ahead and contact my office and let's chat. And with that, I'm Dr. Saadat, a Beverly Hills plastic surgeon. Go ahead and comment, like, and subscribe below to stay tuned with all future videos.